Vaginal discharge is a natural and essential function of the female reproductive system. It helps to keep the vagina clean, moist, and protected from infections. Normally, this discharge is clear or white and odorless, and it varies in consistency and amount depending on the phase of the menstrual cycle. However, when there is a noticeable change in color, odor, amount, or consistency, it may be a sign of an infection. Understanding how to recognize and manage vaginal discharge infections is crucial for maintaining vaginal health and overall well-being. 1. Identify the cause. The first step in managing a vaginal discharge infection is to determine its cause. Several types of infections can result in abnormal discharge, each with its unique characteristics. Bacterial vaginosis, BV. Bacterial vaginosis is caused by an imbalance in the natural bacteria present in the vagina. Normally, lactobacilli dominate the vaginal flora, keeping harmful bacteria in check. When this balance is disrupted, harmful bacteria overgrow. Symptoms: thin, grayish, white discharge with a strong, fishy odor, especially after intercourse. Risk factors: Dutching, multiple sexual partners, new sexual partner, lack of lactobacilli. Yeast infection, candidiasis. Yeast infections occur when there is an overgrowth of candida, a type of fungus naturally present in the vagina. Symptoms: thick, white, cottage cheese, like discharge accompanied by itching, redness, and burning. Risk factors: antibiotic use, pregnancy, diabetes, hormonal changes, weakened immune system. Trichomoniasis. Trichomoniasis is a sexually transmitted infection caused by the parasite Trichomonas vaginalis. Symptoms: frothy, greenish, yellow discharge with a foul odor, itching, and burning during urination or intercourse. Risk factors: unprotected sex, multiple sexual partners, sexually transmitted infections, STIs. Other STIs, such as chlamydia and gonorrhea, can also cause abnormal vaginal discharge. Symptoms: yellow or green discharge, pelvic pain, bleeding between periods, painful urination. Risk factors: unprotected sex, multiple partners, previous STI history. A proper diagnosis is essential to determine the exact cause of the infection. It is advised to consult a healthcare provider who may perform a pelvic exam, take a sample of the discharge for lab testing, or recommend other diagnostic procedures. 2. Follow prescribed treatment. Once a diagnosis has been made, the appropriate treatment must be followed strictly. For bacterial vaginosis, medication, oral or vaginal antibiotics such as metronidazole or clindamycin. Note: avoid alcohol while taking metronidazole. For yeast infections, medication, antifungal treatments like fluconazole, oral or miconazole, clotrimazole, topical creams or suppositories. Self-care, wearing breathable cotton underwear and avoiding scented hygiene products can help. For trichomoniasis, medication, a single dose of metronidazole or tinidazole is often effective. Sexual partner must be treated simultaneously to prevent reinfection. For STIs, chlamydia, gonorrhea, medication, antibiotics such as azithromycin or doxycycline. Follow-up. Retesting may be required to ensure the infection is fully cleared. Complete the full course of medication, even if symptoms improve, before finishing. Incomplete treatment can lead to recurrence or complications. Hit the like button, share this with someone you care about, and subscribe to Knowledge Wise Daily Health Tips. Here, we bring you health stories and daily tips. 3. Maintain proper hygiene. Good personal hygiene can prevent infections and promote vaginal health. Wipe front to back after using the toilet to prevent the transfer of bacteria from the anus to the vagina. Avoid Dutching as it disrupts the natural balance of vaginal flora. Use mild, unscented soaps for the external genital area only. The vagina is self-cleaning. Change underwear daily and wear breathable cotton fabrics. Avoid tight clothing that can trap moisture and heat. 4. Avoid sexual activity during treatment. Sexual activity can worsen symptoms and increase the risk of spreading infections. Abstain from intercourse until treatment is complete and symptoms have fully resolved. Use protection, such as condoms, to prevent the spread of STIs. Notify sexual partners if you've been diagnosed with an infection so they can also seek treatment. 5. Prevent future infections. Prevention plays a key role in avoiding recurrent vaginal infections. Practice safe sex, use condoms, and limit the number of sexual partners. Balanced diet. Eating foods rich in probiotics, like yogurt and kefir, helps maintain healthy vaginal flora. Stay hydrated. Water supports your body in flushing out toxins. Manage underlying health conditions, such as diabetes, which can increase the risk of yeast infections. Avoid unnecessary antibiotic use, as it can disrupt natural bacteria. Regular gynecological checkups are also important for monitoring reproductive health. 6. When to see a doctor. Do not ignore symptoms of a possible infection. Seek medical help if you experience persistent or worsening symptoms after treatment. Severe itching, swelling, or redness, fever, pelvic pain, or unusual bleeding. Symptoms during pregnancy. Recurrent infections, more than 4 yeast infections in a year. Early medical intervention can prevent complications such as pelvic inflammatory disease, infertility, or chronic infections. Managing vaginal discharge infections involves a combination of accurate diagnosis, proper medical treatment, and preventive self-care. By understanding the signs and causes of abnormal discharge and maintaining good hygiene practices, women can protect their reproductive health and overall well-being. If symptoms arise, seeking professional medical advice is the safest and most effective approach. Empowering yourself with knowledge about your body is a key step toward long-term health and comfort. Sometimes a single tip can save a life.